Good evening, everyone. I am Dr. Ford. I will be here in place of Professor Marvel. So go ahead and place your name and your campus in the chat box. We have 3 minutes, well, less than 3 minutes, and we will get started. How is everyone doing this evening?
Okay, some of us are coming from peds before this class, so that might be like a few people that are coming in like right after 8 o'clock.
Yes, that happens.
Okay.
Throughout, yes, it does. Just remind me or remind them once they come in to type their name in the chat box in their campus. Thank you for that reminder. We have less than 2 minutes before we get started. Good evening, good evening. Come on in. Pretty that you can turn your cameras on, type your name and your campus in the chat box. Good evening, good evening. Go ahead and turn your cameras on. Place your name and your campus in the chat box. How many do you usually have in this class? Do we know? Does anyone know a number? So we have a good many in here. 15 already. So
20 some, I think.
Okay, so we're just missing a few. So it is 7 o'clock. Good evening to everyone. I am Professor Ford in for Ms. Professor Marvel tonight. Go ahead and type your name and your campus in the chat box. Do you know that some are just coming in or still trying to get in out of their other class? That's fine. Just remind them once they get in to put their name and their campus in the chat box. As these things are recorded. Remember, if you do have to walk away from the camera, to turn your camera off for any reason, just place a message in the chat to me, not to everyone. Just say, hey, need to do whatever it is that you're doing. Like I said, as a reminder, remember these sessions are recorded, the chats are recorded, and the video. So just I'd like everyone to just know. Okay, thank you, Ms. Swallow. Thank you. So yes, make sure that you direct message me. So make sure that you don't do everyone when you're trying to send me a message. All right, so we will go ahead and get started. Hopefully everyone had a great day. And if you ran into challenges, hopefully you've coming up with some interventions to help out with whatever it is. That you can have a good night after you finish with class tonight. All right, so we will go ahead and get started. We did have a review session. I just had a review session like literally an hour ago. And so remember, the exam is coming up next week, exam 2. So there is a list out there, a schedule of all of the different review sessions. They are voluntary. Know how you best learn. So check some of them out. We all explain different, the same concepts in different ways. And so you just never know what you'll pick up on. And never mind the repetitiveness of it, just from hearing things several times, it'll stick with you. So remember, the review sessions are being held this week. Check out the schedule. As we get the recording, the links, we will post them in the course. The exam is next week. All right, and again, welcome. Place your name and your campus in the chat box. In the event that you have to turn your camera off, leave a direct message to me and go and do whatever it is that you need to do and return. And we will stop. We'll get breaks along the way. All right, so let's go ahead and get started. All right. So I want to, my Jamboard, I wasn't successful with it, but I think I fixed it. So we're gonna start off with a nice little Jamboard activity here. Let me find my little link. And I'm gonna place the link in the chat box. And you click on the link. But I think you all are familiar with Jamboard. Are you all familiar with it? Share.
I was going to ask you what that was.
Okay, so we are going to learn together. How about that? So I will place this, I'm placing this link in the chat box now. So click on that link and it's supposed to take you to, let me go ahead and share my screen. Supposed to take you to this screen right here. And so it's just a way that we can communicate in writing and verbally. So are you all seeing the screen? Now let me know if you're not seeing the screen, because sometimes there is a delay with my screen sharing. So click the link that is in the chat.
It's wanting me to download something.
It wants you to download it.
Yeah,
Yes, so click it if your device will allow it. And it's part of Gmail. It's one of those, it comes from the Gmail suite, so it's safe. So essentially what you're going to do, and you have
to download it.
I'm not sure on your device. It didn't ask me on mine because I have my Gmail open. Do you have a Gmail? If so, it might ask you to download it if you don't have your Gmail open. And if not, we can just put the information in the chat and we can respond that way if you're not able to open it. But it is a part of the Gmail suite, so it is safe. So if we're having problems, we can pivot and we'll put it in the chat box and let you respond that way.
I can't download it because my computer, it says my system is too low. I can't hear you. I can't hear you and download it at the same time.
Okay, so what I'll do, the other option is, as healthcare professionals, specifically as nurses, we learn to pivot. So what I'm going to do is copy this message and you have to respond either on Jamboard or in the chat. So let me stop sharing my screen. And let me copy it and paste it. Let me go here. And so
I can minimize you, like my Zoom screen, and just follow along with you on like where I'm doing it. Is that correct? Like I have it pulled up.
Yes, and you can just minimize it because I'm going to share my screen and you can see what everybody places on there. So yes.
Oh, okay. I just wanted to make sure I was following the directions.
So this is what I need you to respond to. Ways in which you or you see others contributing to contaminating the environment. So just list away, just think about it. Like today, you were out at work, you were, you stopped to get gas. Let me go ahead and share my board. Now, if you're able to do Jamboard, I'm gonna put this back on the screen too. So respond either here. So if you're in Jamboard, if you see this little thing here on the side, this is an actual sticky note. So you click it and then you can type your answer there. And see, we are responding to ways that you, be honest, did you throw that trash outside today? So just think about it. We just go through our day and sometimes we do things just not really realizing that we are doing some bad things, but how did you contribute to contaminating the environment today? Or, what did you see? Did you see someone doing something? And if so, share what that was. So if you're using Jamboard, you click the little sticky note, and in the middle of your screen, this will pop up and you just type whatever it is that you want to type and you click save. Otherwise, type your response in the chat box. Let me see, I think this is a sticky note on top of a sticky note. Yeah. So we'll give you a few more minutes to respond. Ways that we have contributed to contaminating our environment are ways that you've seen others. I'm trying to move my sticky note over here. And again, it's part of the Gmail suite, so it is safe, but we do know these computers and the bandwidth, they have a mind of their own. So if you have some challenges with that, just place your answer in the chat box. Just about 2 more minutes, giving you time to place your answers there. I'm not sure what the little icons are there. This I haven't seen those before, so maybe it's some kind of icon that you have associated with your Gmail. Not really sure. Okay. 30 more seconds and we will just talk about some of those. And this is important because we're talking about environmental health, and you as a nurse providing interventions, doing that head-to-toe assessment of your client, your participant, your patient, of their environment is really important. And sometimes it's things that, we just see so much of it that we just become numb to. But those things really are hazards. We'll start with our chat box. Let me stop sharing. Let me look in the chat box. Let's see what you all shared there. Let me go up here. And so these are things simple, yet they could be detrimental to our patients, to the environment, to others, even to you. We have littering, throwing trash on the street, saw people throwing masks on the ground, not recycling, dumping in lakes and rivers. Wow. So the dumping in lakes and rivers, people were actually, give me more information about that. What does that mean, Blake?
Hi.
Hi.
I haven't actually seen it, but I've seen videos on YouTube where people dump their oil.
And wonder what's that all about. And so and just think about that. We talked about it, was it last week or some along the way we were asking, no, I think it's this week when we're talking about the fresh water. How are people getting water into their homes? How, the water that you are washing your hands with at work, where's that water coming from? Is it coming from those waterways that are being contaminated by pesticides and people dumping oil? And you end up with, your hands start itching, you break out, and you go through the whole, they send you to occupational health department and they do the test. Have anyone ever had those allergy tests where they put the patches on you or they put the little needles all up your arm, trying to see what you're allergic to? And you end up testing out, you're not allergic to anything, but still, every time you go to work a couple of days, your hands, they start to break out. It's not the gloves, because that was one of the allergies that they tested you for. It could be the water that you are being exposed to because the contaminants that are being placed in the waterways. So And the environmental health, it is a huge factor. Someone threw trash out of the car window on the highway. We see a lot of littering, not recycling. Robin, what can we do? What in your area? What can be done about that recycling? What can you do about it? Give me an intervention.
So like making sure that you have the recycling bins in your house or like outside, and making a conscious effort, like if you have plastic, or whatever that can be recycled, to put it in there so you can get it recycled.
Great, thank you for sharing. There are several recycling entities that will provide the different containers and garbage containers or receptacles. If you have a neighborhood or community center, and they will actually provide those containers. One of our students' project was recycling. We actually got funded through, what is that thing called? I can't think of it right now, but someone actually provided enough garbage recycling cans, not garbage cans, recycling bins for like the entire campus. So we were able to set those up throughout the campus. So yes, just providing that there, because sometimes it's just like people just don't know, well, what else can I do with this besides just throw it in the trash? Well, hey, we can recycle that. So that might be one of your interventions that you come up with to improve the environment for your patient, your client. Throwing trash, throwing cigarette butts. So why is throwing cigarette butts a hazard to the environment, Stephen?
Well, so that is kind of noise pollution, like creating some like unfriendly noise, because when the flex pipe is broken or kind of cut off, when you're driving, I've been experiencing some people drive like intentionally with the flex pipe broken, and then it's just making like noise around.
Oh, so you didn't put the cigarette butts in there. Did you make the comment about the cigarette butts?
Oh yeah, I did that one too.
Oh, okay, you did that one too. Okay. I didn't see the other one just yet. Okay, good. So now tell me about the cigarette butts.
Aren't they non-biodegradable? And so it worsens the environment just in general because it's a carcinogen?
Do we agree or disagree, Stephen? Is that why you placed that there? So Tiffany, tell us that again. So Stephen placed throwing cigarette butts, and we're talking about the environment. Like, why is this important for us to bring to people's attention and say, hey, we shouldn't be throwing cigarette butts out? Tell us.
The butt itself, it's not biodegradable, so it won't naturally be broken down. The filter is a carcinogen, so it actually, even though there's no flame attached to the butt, it can still emit the carcinogenics into the air, which is directly what you breathe in. So depending on how many cigarette butts you're around, you're still breathing in that carcinogen that you would if you had secondhand smoke or actually smoked the cigarette yourself.
Exactly. That's what I was going to say too. It's just like that secondhand smoke is worse than you actually smoking the cigarette. So yes. I saw a lady in the hospital take a mask out of the trash and put it on. Wow. Lawn mowing. So how is that detrimental to the environment? And not cleaning it or clearing it? Please explain.
So if they don't clean it, that goes to the sewer system, and that goes to river, or I don't know where that goes, but so I have seen like some people just mow their lawn and leave as is. They don't clean on the side.
And it's a hazard for motorcycles, right? Like when you blow it into the street.
Yeah, it could be, and those, yeah.
Okay, so we are assessing the community. Look at that. Look at you all. So if you are doing your head-to-toe assessment of the community, and so the mayor brought you in and say, hey, we're having all these different things going on. we're having motorcycle accidents, the people are complaining about this. So we just want you, I just want you to just take a tour of my town and just look at the different things that you pose to be an environmental risk. These are the things that you more than likely would identify. And then they would want to say, well, hey, well, what can we do about, you know, what are some things that we can do about this? So, and it seems like simple things, but sometimes simple is yet complex and also noteworthy. And it can play a huge role in someone, like you said, a motorcycle accident. In the event, that could be someone's, you know, they're injured and they have residual for the rest of their life just because of it. And so let me read just a few more, and we're gonna go back to our Jamboard. Wow, yeah, so you did do that allergy test, and that's brutal. I had that done. I was like, oh my goodness, that was something. All right, driving car with broken, okay, that's what you were talking about initially. Okay, all right, good thing. Thank you for sharing that. Let's get back to our Jamboard. So this seems like a, you know, a simple, yet it is something. It is you doing that head to toe assessment of your client's environment. So like I said, the example that I used, the mayor bring you in and say, hey, we're having a town hall meeting and we want you to report back to, you know, the things that you have seen that we can improve upon, because we're trying to improve the health, the environment of our people. So you would look at things just like you all have just named here. Who was that spit that gum out while they were driving? So why is that, and why is that a contaminant? What is it about that gum? You spit it out while you're driving.
Okay, that would be me. And in all fairness, I was slightly choking on it. And so it was a lot easier for me to spit it out in the moment than it was to like try and keep it back in. And it comes back to the fact that it's not biodegradable. And so it's still going to harshen the environment, which is directly what we breathe in and out when we are out in it. So.
Good. Thank you for sharing. See, we own up to it, and he was like, do I choke? Do I run up the road trying to get this out of my mouth? Or it was just easier just spit it out. So it
was a hot mess. Like it was the best of the options that I had in the moment.
That is okay. Thank you for sharing. All right, let's see. Throwing beverage cans out of the window. Saw someone throwing a cigarette butt. We talked about that. Throwing the butts, dropping receipts on the ground. That falls under that littering. No recycling. That's the shit. Okay, good. Thank you all for sharing. Let me stop sharing that. And so just like we just did again, doing that head to toe assessment is like what we just did. Just thinking of those things, just, you know, hey, you know, but sometimes we just block those things out. And we don't realize that, hey, this is really causing people harm. So I'm going to pivot to the chapter here. And we're going to just go over a few concepts, and then we're going to do some review, because I know you all have already read through the chapter, perused through it. So we're going to look at some things I've highlighted. And we're going to do some questions, some scenarios at the end of the chapter, and then move on to the next. So chapter 8, environmental health. Okay, let me share my screen here. Again, if you are just coming in or haven't been, was not in at the beginning, go ahead and place your name and your campus in the chat. Okay, let me share here. So I'm gonna look at the points at the end of the chapter. And at any time, if there's a delay or something, if I disappear off the screen and I haven't said that I was walking away, let me put my number in the chat, because sometimes things just happen. Snafus happening, and sometimes the bandwidth or the weather. I did hear some thundering, but I don't think it's going to be of any significance. So anyways, so in the event that you need to something, you think something's happening to me, or I'm talking and you all can't hear me because things happen, just send me a text or call and say, hey, we're not hearing you, or whatever. So I'm just placing my number in the chat box. Okay, so let me share my screen. All right, so this, of course, is from chapter 8. So some main points: nurses have a responsibility to be informed consumers, to be advocates for citizens in their community regarding environmental health issues. And so we just brought to light some things, that could be environmental health issues. And we talked about, ways in which, why it was bad, why it wasn't good, and things that we can do to help, or an intervention that we could put into place. So you all just thought that through with just that activity. So prevention activities include education, waste minimizing, and land use planning. Control activities include environmental permitting, environmental standards, monitoring, cleanup, and remediation. Each nursing assessment should include questions and observations about intended and unintended environmental exposures. And that is what we just did. So don't look at environmental health as being some huge thing, even though it does amount to, if it's not controlled, if those risks and are not addressed, then we could have some disastrous outcomes. All right, are you all still seeing my screen? So the environments are pretty much anything, the homes, the school, workplaces, is everything around us. And unfortunately, sometimes those environments, they have potential risks. So many of you work, and so just think about when you're at work, the things that you are, your environment, are things in need of repair? Did you report those things? I can remember a friend of mine, her mom was and this is going back to the review, which entity oversees workplace safety? This is a review question.
OSHA.
Oh, great, OSHA. So a friend of mine's mom, that she had to work, she worked at this place, and they had this some type of I don't want to say carpet, but it was some type of rug, so to speak, that they had for them to walk on. It was there for their safety, but it was in need of repair. And they kept tripping over this thing, and it was just their feet, their shoes. It kept getting hung up, or something was going on. Something was wrong. And over time, they went there day after day. Nothing happened to anyone. They tripped, they broke their fall or whatever, and they just went on their way. Nothing happened. But that one day, her shoe got hung up, and then she's still disabled to this day. So your environment is just not only the outdoors, but it is also those places that you work in. So you want to look at those potential health risks and see what we can do to decrease or eliminate the risk altogether. All right, let's see here. Factors including genetics, socioeconomic status, and environmental exposure affect environmental health. So these are some questions that you might want to think about or ask when you are doing your head to toe assessment. So I know ever since 2020, we were already cleaning before then, but since then we have been in overdrive with cleaning, washing our hands. But just think about, have you ever thought about those things that we are using to clean with? Do we have on the appropriate gear, PPEs to clean? Have you ever thought about that? Are we exposing ourselves in our homes to different things? What is that? What potential harm is there? So the environment, a big thing on the rise now is this lead-based paint. Had a person that I knew, their child was just going in for a routine screening. And this is it was part of their healthcare providers' routine things that they screen for. And sure enough, the baby's lead levels were high. And so of course, they sent out the social workers, they did a home assessment, and sure enough, the paint was lead-based. And now they say that the paint is okay as long as it's not chipping. And so once it starts chipping, then that lead is being emitted. So this is an environment. Sometimes, like I said, we don't think of the home as a safe place, but that our home-like environment could be putting us at risk for exposure to those things that are devastating to our health. Radon, there is a large study that's getting ready to, in our state, that's getting ready to be funded, and it's all about radon. So which entity focuses on biomedical research? Another review question.
EPA?
Another one? EPA. Biomedical research, more specifically, they deal with research. Begins with an N. So we'll put that one in the parking lot. So yeah, so the research project that what they're going to do is send out these detectors to the home, and the participants have to call in or answer these surveys every so often. But we do, why is radon, why are they trying to, what is so important about radon? Because there's a direct link between lung cancer and it. And people have it in their homes, or they've been exposed to it and they don't even realize it. So environment exposures are rarely limited to one location or to one source. It's just, everywhere for the most part. So I thought this right here was interesting too. I don't know if you all knew this. Let's see here. Where is it? We knew about the pesticides in the prostate cancer because they're doing like commercials on TV. I don't know if you all have seen those, but the pesticides are linked to liver and prostate cancer. But if you have children and you have regularly used pesticides in your home, they're at an increased risk for contracting leukemia. That was a new fact for me. So, how we are trying to have our own gardens at home. We are, and so to keep the little worms and things from eating them up, sometimes, we use those pesticides. We're trying to have the family gatherings in the yard. So in order to sit out there, we put out the different chemicals and things to ward off the bugs. So we are being exposed to those pesticides. If you do that regularly, if your child is regularly exposed to it, they have an increased risk of contracting leukemia. That was a new fact for me. So those things that we use every day and that we just go down to the little local Walmart and buy, initially our environment might not have any contributing factors, but because we're adding those things to try to ward off the bugs, the ticks, so that you can sit out in the yard, you may be adding or creating an environmental risk for yourself. We can't get away from Healthy People 2030. Each chapter has some specific objectives. So make sure that you're reading through those, and you can go directly to that website, and they do have those toolkits and things that you can look at. So let's make sure we read over these because we do see these on the exams as well. So 2030 for environmental health, increase the proportion of people whose water supply meets Safe Drinking Water Act regulations. I forget what town that was. It was a couple of years ago where the
It's Flint. They still don't have clean water.
You're right. That's exactly where it was. Exactly. And
have you ever watched the Netflix special on that?
No, if you would just
you should check it out. It's pretty eye-opening.
Give us the brief. Give us some brief facts about it. What I remember is whoever the water authority people were not. They were checking the levels of whatever the levels. Was it chlorine?
It was a company that came in and they were doing. I can't even remember the specific type of research or manufacturing, and it was all spilling into the water supply. And they tried to cover it up, and they were literally paying people in the health department to not lie about test results, but to not disclose test results to parents. there was a woman that worked in the health department, and she shares her story about how that she was essentially said you can either get fired or take a leave of absence without pay if you disclose actual results to families. And it's really disheartening to see, and all the kids are so sick and nobody can afford, I mean, the town, because nobody wants to live there to begin with, but it's all those factors that you were talking about at the beginning affect that water supply and that community, the socioeconomics, everything about it.
Well,
Michael Moore is the director of it.
Flint itself was a very bad, like, high crime rate anyways, let alone for this to happen to it.
Anyone else see or is aware the Flint situation with their water? What happened? I want to say maybe 5-7 years ago now.
I think something about like the water came in from Detroit, I feel like, in that, but I travel past there multiple times a year, and if I stop there, I don't even wash my hands with the water. I use hand sanitizer. Like, my kids know not to drink the water there. Don't, if we have to stop at the rest area, just use the restroom, flush it, and then we'll hand sanitize, not even to wash their hands, because I don't know.
So what about in the areas that we live in? How do we know that we're not the next Flint? And how can we be proactive in ensuring that we're not the next Flint? Please share. Have you ever experienced, like, you turn on the faucet and like, whoa, and then it quickly cleared up, but there's been times it was like, wait a minute,
we can't drink our water. We can't drink our well water at our house. Everything's bottled. I mean, even though we have it's pretty crazy, the filtering system that we have, and we have 2 water softeners, but even when our twins came home, everything's bottled water. I don't cook with our water, even with the filters on it.
Anyone else care to share? What can we do about it? Because, we could be the next Flint, or Flint plus whatever else. It might not be that they're hiding numbers. It could be just the next thing that's happening. I know where our campus was located, we always talked about there was a water, I don't know the correct name for it, but the water place, that's not correct, was next door. And, they deal with chlorine, and chlorine at its purest form is really, really explosive. And so we would always, in our science class, we were always like, when we were talking about the periodic table, why is a water company this close to a school campus, a community? It seems like if the wrong thing happened, that person wasn't paying attention, and thank God nothing has happened, but the potential is there for a disaster to happen. But it just seems like those places and things that are at high risk for things happening, there should be a rule or something that you shouldn't be able to be near a community or something within so much footage or yardage. And so, anyone else like to share anything about this Safe Drinking Water Act?
So where I live near the Scott's Miracle-Gro factory. So our worry is always that the chemicals from the Miracle-Gro will get in our water. I don't actually drink the water that we have here. So a lot of times you can smell, you go out of my house and you smell fertilizer. It's really chemical, smelling. So we just, don't drink the water.
Exactly. Anyone else? One more, we can hear from one other person, then we'll move on. So these Healthy People 2030, these objectives, they're real. I mean, they're real. These things, these are things that people have, that has been identified as problems. And, and it might not be in your area, but your area might be the next area. So make sure that you're looking at those and be thinking it through. what can we do now? We don't have any known hazards, but what can we do now to prevent, beyond just being in this class? But if that's where you're living at, like you're saying, you all are being proactive, not drinking the water, not cooking with the water. So what are some other things that you can do? Toxicology is the basic science that studies the health effects associated with chemical exposures. So I highlight this whole paragraph. Let's see, what was it that I wanted to bring out? Both drugs and pollutants can enter the body by a variety of routes. So yes, just thinking about all the different ways that we get exposed to the different chemicals. Sometimes, we just don't even realize, that we are absorbing things through our skin. A certain time of day when those tractors and things, if you're in an area where that industry, where they let off whatever it is that they let off into the environment, that might be the time of day that you all do not sit outside on your porch, or you don't do any activities outside. Not to say that that exposure can't happen inside, but you're being more exposed if you're out because of that direct ingestion or absorption. So think about when you're in the work settings, you want to take the time to put on your protective gear, those gloves and things, like, oh, I'm just putting on this patch. But remember, that patch that you're applying, it has medication in it, and you're applying it to the person's skin. And if you don't have on the protective gear, guess what? If you're putting that patch on and you come in contact with the side that has the medicine on it, you're absorbing it as well. So just make sure that in those different settings that you are looking at all those environmental risks. And I think we're exposed more than we really realize. Epidemiology, you do need to, you need to know the definition for the exam, and just for, also just to know about it. But for exam purposes, you do need to know the definition of it and how it applies to the infectious epidemics and other health-related events. So epidemiology is a science that helps us understand the strength of the association between exposures and health effects in human populations. So then we get to talking about the triangle. Someone tell me about the triangle. What are the three major components of the epidemiological triangle? Tell me about those three things. You do need to know that for exam purposes also. So what are those three?
Isn't that like the agent and the host
And the environment?
Yeah.
Okay. And so what is the host?
So like the host is like, say, a bug or something, or like a mosquito or something, is the agent, and then the host is like you, who it implant, like it bit, or it like, or like something implants in you, you're the host for it to grow or whatever.
Okay. Do we agree with Miss, is it Rakia?
Is Rakia.
Rakia, do we agree? We're talking about the host. So someone agree or disagree?
I agree.
And why do you agree?
Because the host is like she said, it's who's affected. It's who's going to carry whatever they were infected with, and that will turn around and spread to whoever, depending on, what they were infected with, spread to anybody that they may or may not come in contact with. Like COVID, first person that got it, they became the host, and then they spread the virus.
Good. Let's talk about those other two components of this triangle. Someone else. Let's talk about the other parts of the triangle. Let me hear from you.
So the agent that's like the what they're spread, like what, like it would, like Tiffany said, that would be COVID. That would be like the issue with, I don't know, what they're spreading, what disease they have.
Okay. Do we agree with, who is that, Robin? Do we agree with Robin? Or we disagree? We're talking about the agent.
Yes, the actual virus is the agent.
Okay. Good. And let's talk about that last little part of the triangle. We talked about the host, the agent. What's the last part of the triangle?
That's the environment.
Or where? Okay. All right. Good. And so let's go ahead and let me make sure I don't have any other points that I wanted to make sure we looked at in this chapter. We're going to do some questions here in just a moment. That's that chapter. Make sure we've covered all those points. So we talked about the different environments, thinking about your work, your child's school, where you work at, your home. Each location has its own unique environmental exposures. And then sometimes, you know, we are exposed to the same thing in several places, different things in different places. So just think about the assessing the environment. I wanted to look at I prepare. So let me share my screen on this. This is box 8.2 in the chapter. So you're trying to do an exposure history. And these are just some points or things that you might want to think about, you know, while you're investigating. Have you ever felt sick after coming in contact with whatever the substance is? Do you have any symptoms that improve when you are away from your home or work? Remember I just talked about, you know, your hand, when you go to work, after working a couple of days, your hands are broke out, they start to itch, but then you've had the test done. And, you know, with those allergy tests, they test for those, you know, things that are most common, but something might be only pertinent to your work water. And so you're only experiencing these symptoms when you are at work, you know, after being working those several days. So some other questions, are you exposed to solvents, dust, fumes? Are your work clothes worn at home? These might be some interventions too, as we'll look at in one of the scenarios here in just a few. It might be, you know, you educate your client or your patient about, you know, hey, if this is where you're working, you know, when you come home, you need to take all those, you know, those clothes, I need to change clothes immediately because you're being exposed to that. Those things, even though you were wearing your protective gear at work, some of those things, some of those substances, those remnants still might be on your clothes and shoes. And so if you're wearing those clothes when you get home and those same shoes throughout your home, you're exposing your family. And also you are being continually exposed. So when was your residence built? We talked about the lead. Lead was just a known part of paint up until, was it the 60s? Don't quote me on the date, but you know, it was known that lead was in paint. So if someone lives in a home that is past that year, then paint is automatically in that home. But they say it is not dangerous if it's not peeling. So that's why we want to know the age, you know, when was it built? So that was a good, look at that chart. Make sure you look at that chart just to see those different things in there to help you come up with interventions. All right, and I believe that is it for that. So now I'm going to look at about 3 questions. Oh, let's look at the levels of prevention. I want to look at that. So remember, when we're talking about prevention, we have 3 levels. So someone tell me, what is a primary prevention? What's the definition of it? If you were trying to explain to someone, a primary prevention is what?
That's like the prevention even before you have the disease or the illness or whatever. You want to prevent it before it even starts.
Okay. What about secondary?
Secondary is testing.
Testing. Thank you for sharing. What about tertiary?
That's when
That's
you
where
already
they-
have the illness
Yes,
and
ma'am.
you're just trying to prevent it from getting worse.
Okay. So these are just some, and this is what you already know, but just to reinforce what you know. Primary prevention is the education you're promoting, those things that we do when there is no disease. And tertiary is the opposite. We can provide the education. It could be the same intervention, but if there's a disease process there and that intervention is specifically related to that disease process, then it becomes tertiary. Now, what happens if a person has a disease process, but the intervention does not address or have anything to do with that disease process? Would that still be tertiary? The question is, just because a person has a disease process and we are giving interventions, or you're trying to decide which level of the intervention is, the prevention is, does it automatically mean that that is tertiary prevention?
I don't think so. I would say because if it's, say they have diabetes and you're teaching them about diabetic neuropathy, they already have the diabetes, but they don't have the diabetic neuropathy, so that's like a new illness. So I would say that would be primary prevention if you were trying to, explain to them about.
The diabetic neuropathy is still part of diabetes. You wouldn't get diabetic neuropathy if you didn't have it. So wouldn't it still be a tertiary prevention? You're preventing further complications from something because you have the disease already.
You mean like injury because of the neuropathy? Is that what you're talking about?
Yeah. I mean, if you already have diabetes, there are a slew of complications that would only happen if you had the initial disease. So wouldn't all of those that would subsequently follow once you have that initial disease, wouldn't that still be tertiary prevention level?
You have to be diagnosed with neuropathy for it to be tertiary.
Right. But if you didn't have diabetes, you wouldn't get diabetic neuropathy. Yes or no?
Not all people have diabetic neuropathy.
Okay. Maybe I'm not asking the way I should be. I'm not a diabetic. If I'm not a diabetic, I'm not going to get diabetic neuropathy, correct? So the only way to get diabetic neuropathy is if you have diabetes. The only way to get it. So it is a disease that manifests once you already have the diabetes. It may or may not manifest, but it comes after the diabetes, which is the initial disease. Therefore, wouldn't that still be tertiary prevention? You're preventing the diabetic neuropathy because you're teaching them about what could happen because of their diabetes.
But isn't tertiary, you're trying to resolve the issue, where secondary is where you're doing the more prevention from it getting worse or developing into tertiary?
You can't cure something that's already like your diabetes, unless you have a specific type, you have that diabetes. So I guess maybe that's not a good one for this initial example, but if you have that diabetes, you have the initial disease. From there, to prevent further complications because you can't correct what you already have at the moment.
Like maintenance, further complications.
Yes.
Right? Or is that wrong, Dr. Ford?
Healthy conversation. I love it. I love it. And so both of you all are correct in it partially. And so we would lean more toward which one in reference to the person, if we're providing the early detection for diabetic neuropathy. Would it be secondary or tertiary? The person doesn't have, they have diabetes. We're saying that, but they do not have diabetic neuropathy. So we're providing a screening test to detect or we're providing education to prevent diabetic neuropathy. So would that be tertiary, primary, or secondary? Person doesn't have diabetic neuropathy. They do have diabetes.
Well, if you're
Secondary.
doing a test, that would be secondary, but if you're teaching, this is my thought. But if you're teaching them about diabetic neuropathy, then that would be before they have it. I would think that would be primary.
Because they
I
don't
see
have
what,
But is it be tertiary? Because on your slide, it says when there is a disease process.
Yes, but the disease process they have is diabetes, not diabetic neuropathy. Tiffany is correct.
Okay.
If you don't have diabetes, you're more than likely not going to end up with diabetic neuropathy. That is correct. But remember that the disease, they have to match, so to speak, sort of, kind of. So the disease in tertiary is the person's a diabetic. Person doesn't have diabetic neuropathy. She is correct in saying that someone that doesn't have diabetes is probably more than likely not going to get diabetic neuropathy, but they have not been diagnosed with it yet. So if we are providing education so that they will not get diabetic neuropathy, not so they won't get diabetes, but a complication of diabetes, a potential complication, we're just providing the education for, because the disease that we're talking about is the diabetic neuropathy, right? But it's people that don't have diabetes are not going to end up with diabetic neuropathy. But all people that have diabetes don't end up with neuropathy.
So
Yes.
everything has its own entity. Like it can't just be blanketed as like part of the disease process. It's its own entity when you're discussing levels of prevention.
If everything has its own.
Okay.
But then on the other hand, Erica, they are, because we just said you're not going to end up with neuropathy. Yeah. So it's like, what do you do? What do you do? So okay. So we're going to table that one. So let's do one that the test. So for exam purposes, it's not going to be that thought provoking. That was beautiful. I love it. You all are thinking. So the person.
What would you answer on that question?
I would do secondary. Then if we're just educating, I would do primary. But my thought process would go just how you all just did it. I would tussle with those answer choices. Oh my goodness, this person has diabetes. I know, this could lead to it. So that's how my thought process would be. But let's go with this way. Robin, you started that. That was good, you all. So the person has, and we're gonna jump to the other chapter real quick. The person has diabetes, and we are asking them to go ahead and make the date for their screening colonoscopy. So would that level of prevention be tertiary, secondary, or primary?
if it's screening colonoscopy, then that would be secondary, right? Because we're
Exactly.
doing the screening test.
There's a disease process, but we're screening them to identify, to early detect if there's something going on with the GI system. So, but there's a disease process there. They have diabetes, but it's not specifically related to, polyps or colon cancer. All right, so let's move forward here. Let's look at these few review questions here. And we do want to give just a short break. Let's look at these questions real quick, you all, then we'll give a short break because we want our environment to be safe, so we're not just sitting still and not moving. Just so give me one moment. Let me pull up these questions here. And so when you're taking your exam, you all are full of knowledge. I mean, if we had to place file cabinets in your room of all the knowledge and understanding that you have, it would be full. So, but when you are trying to select that correct answer, the most correct answer selects all that apply. You should be, if your bells and whistles, if you're not having conversations with yourself, just like they just did about the content, You may need to go and review the content again, make sure you have an understanding of it, because that is the thought process behind it when you're trying to select all that apply. All right, let me share my screen here. And we just have 3 questions real quick. And let me know if you already have reviewed these questions, and we will move on to something else. Okay, let's see here. Let's just focus on question number 1. What I'll do is actually leave the 2 questions on the screen. We'll give you all 5 minutes and just have your answers when we come back. That way we can do 2 things kind of sort of at one time. So we are going to feel free to turn your cameras off. I'm going to set my timer for 5 minutes. When we come back, let's discuss the answers to these 2 questions. And stand up, move around, go get you something to drink, use the restroom. Three minutes left. 3 minutes left. Take a break. We'll be back to go over those two questions. 3 All right, our time is up. And so let me turn my camera back on. All right, so let's look at a few questions here. We're gonna try to move on to the next two chapters here. Okay, so. All right, so what are we looking at for our answer choice for number one? Residents in the community have verbalized concerns over chemicals used in the grape fields and the power plant. They have also wondered if there are any environmental concerns related to the massive power lines above the town. The residents believe that the women have experienced high numbers of miscarriages and that these factors must be related. So number one, someone read the question for us and you all start put in the chat box, A, B, C, or D, or whatever you think the answer is. Go ahead and start loading the chat box up. Just, you don't have to put number one, just put the answer choice, A, B, C, or D. Someone read the question for us and we'll look and see what we're placing in the chat box for the answer.
The public health nurse has a responsibility to be informed about environmental health risk in the community. In what way is this competency demonstrated? I would say A, the nurse provides education and advocates for policies that support a healthier environment.
Okay, let's see. Few more, go ahead and place your answers in the chat box. We have an A and a B. Let's see. A or B. We have A. Okay, we have another A or B. So Erica and Tiffany, let's talk about answer choice B. Tell us, why were you thinking that?
So they would have to be knowledgeable about the high risk, like the population in their community that are at higher risk
On a
to
larger
advocate
scale.
for those patients, for that population.
Okay.
Or no. But I like A too.
I know both of you all put A and B. So I was just trying to think, just trying to hear your thought process behind B. So
Community
you're
nurse, you're
talking-
going to have knowledge on all different kinds of diseases, whether it's a local scale or on a much larger scale.
Like the
So
leukemia that you pointed out earlier.
Yeah.
Good. So get a thought process. And so I do agree with you all. The answer choice is A, the nurse provides education and advocates for policies that support a healthier environment. So what is advocating? When you're advocating, when someone's advocating for someone, what is that? What is that? What are they
So
doing?
like they're being a voice for the community, kind of.
Okay. Advocating. If you were telling someone.
So like you're educating a specific group of people about something specific, like for an example, when someone's doing like Breast Cancer Awareness Month, people are advocating for people with breast cancer because you can't get results for a specific problem unless people know about it, and nobody can know about a specific problem unless somebody's advocating for it.
Okay, so during the Breast Cancer Awareness Month, October, for the most part, people, they take up donations and they have walks and different things where they're getting the monetary so that, you know, for one, they can provide mammograms for people. They're putting money out there, providing stipends so people can have funds to go back and forth for treatments. And so they're standing in, they're the go-between, they're the person that's standing up for those, they're advocating. So what if the person didn't speak whatever language that the healthcare provider was speaking in? What would you, how could you advocate for that patient? I think you are
You would advocate for your patient by utilizing an interpreter and trying to like sympathize for your patient and the difficulties they might be facing by not understanding what's going on. So that could make them nervous or scared or, you know, not really sure what's going on. But, you know, if you had an interpreter, it would make them feel more comfortable if you were advocating for them.
Exactly. Great. I agree. Let's move on to question number 2. Which of the following sciences would be used to study the poisonous effects of chemicals in the community? Put it in the chat box. What are you all thinking? Toxicology, epidemiology, chemistry, or pharmacology? Let's see what you all are saying. Everyone is saying we have Tiffany has a B, epidemiology. Tiffany, would you look up, tell us what epidemiology is? Let me see here. We have A's and 1 B. Let's look at, let me go
I
back.
pressed the wrong button.
Okay, so what were you trying to press?
I meant to press A, but it came out across B.
Okay, well, that is okay. We caught our mistake. So I was gonna pull it back up for you, let you all look at it one more time. But it seems like everybody does understand what the definitions of those are. Okay. All right, and then let's look at that last question. Let's see here. What are the ways in which a community health nurse could assess the environmental health risk of a population? Select all that apply. So we do have some commonalities. Okay. Everybody's saying their location, functional location. Okay. Is it teak? I know I'm not pronouncing that correctly. Explain why did you say ACD? Medium, setting, functional location.
So
Please.
medium, I think, is the sources. How do we find out what's going on down there? Maybe from some people from the community or somebody who's gonna come and tell you that, oh, this is going on that location. And I like D is like where that's going on, that exact location of the place, that environmental things going on. And like setting, what type of setting is that? It is like a building or ground or like a house, I don't know, different types of locations, different types of settings.
I'm trying to slide it. Let's see here. All right. So a lot of you all selected D. Is it teak or tech?
Tech.
Tech. Okay. You are correct. So someone else, why did you all select D? Let me hear why you all select functional location. So the correct answer is medium, setting, and functional location. Why did you all select functional location? Anyone? Thank you for sharing. Yes. go to the next chapter here. Okay. You all done got quiet on me. Let's move on to chapter 32, the nurse in occupational health. I did want us to look at that little quick video, and then we'll move on into some other important points here. Let me find that video real quick. I had it up here.
Can you explain again why it was those three answers?
Sure. Let me just give me just one moment.
Could you paste, copy and paste that into the chat, that question?
The question, I don't know if I can put the question in the chat. I can talk about those things. Let's see here. Hold on one moment, you all. You all, it's a hazard to have too many tabs open. You have them available when you need them, but then I got too many tabs open. Okay, all right. So let's look at it quickly here. One moment. So remember, and I'm still looking for my video, but I go ahead and talk. So the medium is like the air, the water, the soil. And then for the location, it provides those unique environmental exposures, which some of these things are going to overlap. And it's like, but those are the things that you want to look at. So it was the medium. And you also want to assess the settings, such as certain things occur or occur more often in rural areas compared to suburban, compared to urban areas. And then the functional location, those are more specific. Like, are you at home? Are you at school? Is it your workplace? So the demographics and the social economic status, they don't typically, those are usually factors that are not typically when you're assessing environmental health factors. So the environment was like the key word. So demographics and socioeconomic status are important things, but we're talking about environmental health risk. Now, the socioeconomic, socioeconomics may be the reason why this person is in this type home or staying in this type setting in a rural compared to a suburban area, but the key word was environmental. Okay, let's look at this video here. We're gonna move on into occupational health. Here we go. Hold on, you all. I'm not sharing, but I'm going to share here. And just one moment. And of course, this video was posted in your the announcements for the week. And so it's a good one here. Play.
Before I became an occupational health, I was a mother baby nurse. And so I had a pregnant lady come into the clinic and I took her blood pressure and it was a little bit high. She told me she had been at the doctor earlier that
Dr. Ford?
You know, that took a lot of like rapport.
Yes. Did I miss something?
It wasn't, I don't know if everybody else was. There's no sound coming from it.
Let's try it again. Let's see. And it's just a short one, but it's our segue into the occupational chapter. Let's see.
Before I became an occupational health, I was a mother baby nurse. And so I had a pregnant lady come into the clinic, and I took her blood pressure and it was a little bit high. She told me she had been at the doctor earlier that day and that her doctor told her it was fine. But using my skill as a mother baby nurse, I knew that she could potentially be pre-eclamptic. And so I told her she needed to go back to her doctor. She went back, they admitted her into the hospital and they did an emergency C-section. She later sent me flowers. I didn't know she had gone to the hospital, but she later sent me flowers and told me that I had saved her baby's life.
One day, one of my coworkers had chest pain. Because of the trust and were central in the manufacturing plant, he actually was in my office in less than 1 minute from his initial set of symptoms. Every time we speak, it's always, I wouldn't be here if it wasn't for you.
She called me from a car one time and said she was contemplating killing herself, running off the road. So I was able to take that moment, have a conversation with her, redirect her, get her into our employee assistance program resources. She took that story to our vice president of HR, who was really touched by that. And, it was an aha moment for him that occupational health nurses save lives. That took a lot of like rapport and development over the years in order to foster that closeness or that relationship where she trusted me to give me that call. She didn't call her family. She didn't call the police. She called the occupational health nurse practitioner.
When he had that stroke, he realized that, he got to the doctor in time, minimal long-term effects from that. In fact, no long-term effects were. And then he actually started a program, Biking for Life, as a result of that. And so he tells people, well, it was because of the nurse and her advocacy for blood pressure that I did that.
In Bryn Mawr Hospital, and we actually we did employee health. We also did some primary care for employees, mostly triage, that they would come to us for health questions. And it was 3 days before Christmas, and I had a young woman and her husband come in, and she had abdominal pain. And I had evaluated it, and it was quite concerning. I was really worried about the tilt. And I got there, and they said, the doc's not in today. So I wheeled her directly to the emergency room. By the time I got her to the emergency room, her blood pressure was 70/40. They had her on the operating table within 10 minutes. She had blown a splenic aneurysm. And the really sweet part about it is she survived. And every year on the anniversary, she would bring me a bunch of, makes me cry. She would bring me a bunch of daisies because she told me she'd be pushing them up. It worked.
We had one of our DOT drivers, Department of Transportation drivers, that was not driving properly, and the supervisor sent him down to the clinic because he thought he may have been under the influence, which is a reasonable suspicion. Further evaluating him, we discovered that he had a new onset of seizures. And so just that program being a part of our occupational health, we were able to identify there was a problem and eliminate the possible reasons and then discover what was really going on. And he was able to get treatment without hurting anyone and get on a proper therapeutic program to get him better. And he is still working for the city and in a different role, of course, and still being productive.
It's one of those things that you do what you do, and you help people and you make a difference in their life, but when they come back and thank you for that, it's like, yeah,
I am where I need to be. I am exactly where I need to be.
And so my question to you is, let me pull up my little Jamboard here. Okay, and let's see here. Let me minimize that. So my question to you, if you can't use a Jamboard, go ahead and be putting in the chat box. What is the role of an occupational health nurse? Let me pull up my Jamboard here. What is the role of the occupational health nurse? And for those of you that can use Jamboard, let me get it pulled up. Uh-oh, clicked the wrong thing. What is the role of the occupational health nurse? And I'm getting ready to share the link. If you can, use the Jamboard, please do. Here we go. And if you can't, just go ahead and place it in the chat box. And let me share my screen. So the role of the occupational health nurse, I give you all a few minutes to look at that, and I'll do some discussion from the chapter here. Go to my points here. So you are discussing the role of the environmental health nurse. Occupational health nursing is an autonomous practice specialty. Workplace hazards include exposure to biological, chemical, and environmental, physical, and psychosocial agents. We talked about OSHA. They are there to ensure that employees are providing safe work environments. And we do have workers' compensation in the event that there's an injury, a work-related health injury that is there. So you are putting in on the Jamboard. We'll look at it here. You're explaining to someone what is the role of the occupational health nurse, or you are placing the information in the chat box. So once you place that in the chat or on the Jamboard, let's take it a step further. So tell me some places, name some settings, be specific of places that you know that have occupational health nurses and or that should have occupational health nurses. So what is the role of the occupational health nurse? So I just mentioned that they are autonomous for the most part. They are known as solo clinicians. So they're out there and you are taking the healthcare to the people. So whatever occupational setting that they're in, you are there. But there are additional roles to the occupational nurse, health nurse. In many companies, the occupational health nurse has assumed expanded responsibilities. You know, they're looking at job analysis, they're doing safety analysis. You know, they're working alongside the workman compensation department or whomever they have secured to, I'm going to share my Jamboard. Whomever they have secured to provide those workman compensation services for their employees. And so they are trying to be proactive in having the occupational nurse do some, assessment of the data that's there. Let me make sure that there's none on top of each other. So the role of the occupational health nurse, we have treat, assess, and prevent workplace injuries. My husband's work has one, he's in construction. A nurse who's an advocate for workers, making sure they have a safe place to work. GE Aviation in Cincinnati. So has your husband, if you don't mind sharing, has he had to visit there, or has he talked about what they do in the nurse's office? You don't have to give anything personal. Do they do workplace wellness? Like, what do they do from day to day? Has he mentioned?
They do like safety meetings with like the supervisors of jobs, and anytime there's like a workers' comp claim, like they work with the company to go back and assess how it could be prevented, what they're going to do about it as far as the actual employee that was hurt, things like that.
So which two levels of prevention would you think the OHN would mostly use? Primary, secondary, or tertiary? What are your top two, you all?
Are you asking me?
Yes, and
and
the class.
I think it would be all three.
So if you had to
I would
pick
say
top
mainly,
two.
hopefully primary and secondary.
Two.
Yeah. Okay. So they don't want to hardly ever use that tertiary one because they're trying not to get to that injury, that disease process. So yes, the top two. They use all three, but because just think about it, if they have someone that is a diabetic, that has diabetic neuropathy, here we go again with this conversation, and Robin, it's all your fault, and the safety gear, and they're not wearing their safety gear, their shoe safety gear. I'm just making up something. And they reported to the nurse that they injured their foot. I don't know. You all help me out with the situation. And so, but anyway, so that is taking the healthcare to the people, meeting people where they're at. So where, besides the family, where do we spend most of our time? At work. And so in order to keep us at work and also to be productive and safe, people have decided they created a whole profession. Like, if the industry is big enough, they have their own healthcare team right there. And so we do know that the workers do have disease processes that need to be managed, or they may have some acute instances where their blood sugar may drop. And so, if they have that healthcare team right there on spot, then they can provide that immediate care. And they might not have to go to the hospital or to that, that clinic or whatever. So occupational health nurse, it's a biggie. It's a lifesaver. It's sort of kind of like the school nurse. They have that whole healthcare team right there on the spot, doc on the spot, nurse on the spot. And so, yes, you all are correct. They treat, assess, prevent. They provide that education. And of course, it's going to be tailored more toward whatever that industry, that occupation is, because if that industry or occupation involves them having to wear specific gear, or as to prevent hearing loss and things like that. So your education and your interventions will be more geared toward that. Let's see here. Anyone else have an experience or have anything to share about occupational health nursing? Any personal experiences? Let me look in the chat box and see what you all shared there. Hospitals and these, let's see, primary. Okay, let's see. What else? So where were they? And Giuliani. I'm not sure if I'm pronouncing your name correctly. You are correct. Wherever there are workers, you just summed it up. I love that one. Wherever there are workers, yes. But for the most part, the larger industries, though, they're the ones that say they can afford those because they're paying those direct salaries. I do see your messages. Those of you that are sending me direct messages, I do see it. Do what you need to do. Thank you for documenting it. Thank you. And so what about you all didn't mention, so what's another setting that we are getting ready to go into that season? Here it is, August, for sure by September. What is that setting that's going to have, and I don't know if they call them occupational health nurses, but they're part of that healthcare team. Is that time of year, school is getting ready to start, and I'm sure the professional teams probably I know they do, but they probably don't call them occupational health nurses. They probably just call them something else, but they're nurses. So let's see, is anyone going to guess what I'm talking about?
So it's flu season that's coming up.
Flu season?
So at my job, I work at a prison. So the nurses that work in the infirmary typically handle our like flu vaccines for our staff members. And like a bigger example, I guess, during COVID, the healthcare administrator, who's like the main nurse in the infirmary, started handling all of our COVID vaccines for our staff members and kind of took charge of that. So she's not necessarily an occupational nurse. It's more there for the inmates, but she took care of a lot of the staff members when COVID got started, and she was kind of in charge of COVID leave or, anything like that.
Yes, thank you for sharing. That's what I was saying. They may not have called them occupational health nurses, but they really did serve in that role. You're exactly right. So we know flu season is coming up on us. What else is getting ready? And what's another setting? And the college students might not have them, but the professionals, I'm sure they have nurses on their healthcare team. They might not call them occupational health nurses, but what are we getting ready to start that season for? Something that we all like to watch. It starts on Thursday night, Friday nights, all into Saturday. What seasons getting ready to come up? Flu season, and what other season begins with the F? Football. Yes. Now, I'm sure that the professionals, they have their whole healthcare team, from the docs to the nurses to everything. And they probably don't call them occupational health nurses, but really, if you think about it, the professionals, that's their occupation. And so they do have their healthcare team. So flu season, football season. Yes. All right. So I am going to share another scenario that talks about occupational nursing here. And we're going to answer 2 or 3 questions. And then we are going to move forward. Let me look at my notes just to make sure that we pretty much brought out everything for occupational health nursing. So of course, our purpose is to promote health promotion, to maintain, to enhance the well-being of the whole individual, the groups of employees. This may include, you may have to design some programs, you may have to enforce some programs that are already out there. Some employers hire the occupational nurse teams to come in, like I think it was Megan just mentioned, during those seasons. They know flu season is coming up, so they have funds set aside. They don't employ the occupational nurses full time, but during those seasons, they have those people to come in and offer their employees the flu vaccines, the pneumonia vaccines, those little things that are specific to those seasons. And then, they go on their way. So that might be a job setting that you might like, where you go in for that moment in time and that's it, and you come on back out. You're not actually there every day in that particular setting. All right. And so what other notes do we have? You will use all 3 levels of prevention in the occupational setting. I'm trying to get our question up here on the board. Any other comments about occupational health nurse? So for exam purposes, you do need to know the role of the occupational health nurse. And you all did provide information about that. And here we go. Let's go over these 3 questions here. Let me share my screen. All right, so we'll give you a few minutes to read through the scenario and just jot it down on your paper, what you think the answer is.
Can I ask you a question real quick?
Sure.
Are you going to share your PowerPoints with us?
Hold on.
Or at least the recording.
I mean,